I'm super curious to ask you, so what are the pros and cons of MDT practitioners becoming board certified?
So I would say on a personal level, one of the pros is that becoming board certified in whatever anyone's specialty area, being recognized as a board certified specialist, clinical specialist in that it means a lot, so board for physicians, the board certification is important. I would put that, I certainly think MDT as a foundation is an important thing, but I would put that, up right behind that in terms of prestige. There is a certain level of prestige. The community, patients recognize board certification. I've had people that are MDT diplomats that say, look, to my patients, seeing that I'm a board certified clinical orthopedic specialist, means more to them than I have a diplomat in mechanical diagnosis and therapy. The public doesn't yet in mass realize the beneficial nature of that and what a diploma or credential in MDT means. So, but they see board certified, they know that you've been through a rigorous process. So, I've had some people say that they actually have had more patients come to them through that than through MDT means, even though they use MDT. So it does have a level of personal prestige, and it does show that you've met a very high standard. So that would be a pro from a personal level. From a larger level, I think in discussions, we hear clinicians on part A through D talking about how do I get my other clinicians to listen to me? I'm telling them about MDT. Well, part of it within a practice could be if you have that OCS, there's a level of respect that goes up, for that. And so they're more apt to somebody that's going to sit up and take notice. And so there's that within, perhaps a practice. And then at the larger level, as I mentioned before, getting presentations done, getting on platforms and posters and things like that at these other meetings so we can expose the wider orthopedic physical therapy community to the benefits of MDT. We get that again. I'll use the phrase again because this is what Ron Schenk said. We can get the seat at the table, that they'll listen to us because we have their credential. We have an instant respect. They go, oh, you're OCS. Okay. Well, that gets their attention. And now they're going to be more open to listening to what it is that we're doing rather than thinking, oh, MDT, they're off there doing their own thing and they're not really a part of the mainstream of orthopedic physical therapy.